When I first went to Uganda in Imbarara, I only knew that there was a new medical school, that it had a community-based focus, and there were few faculty and even fewer resources. But when I got there, I found that one of my former medical students was the acting dean, and he had two big dreams. This is the sign on the highway. Thank you, Coca-Cola. One of his dreams was to have a network of community-based health workers in the villages who could help improve child health in the area. And we started the following year in 3 parishes. This is one of the health workers, and they were selected by their community, and they were often people who showed some initiative, such as having his own radio and sharing it with other people in the community. They were trained in the villages. This is one parish of 36 health workers, 2 from each village, so there were 17 villages, and the breastfeeding mothers often brought their children with them, who stayed on the mats and were passed around to the other health workers during the course. Because public health messages are so boring and repetitive, immunize your children, use bed nets, we tried to introduce stories and interactive techniques as well as visual aids. And this is one of the trainers using a flannel board that we made there. They also used puppets. We started with puppets I obtained from the thrift shops here that were hand puppets, but when we wanted to be sustainable, we had them build their own puppets, and of course they were much more imaginative and much more effective. And they included masks as well. Drama was an important part of the teaching, and this is a drama competition. The drama is about how to deal with a difficult mother-in-law. And you can see that the health workers in the back are watching the competition, and you can see how effective and realistic their materials are. Songs were a way for them to memorize what were the danger signs for pneumonia and malaria, and we used them a lot for newborn care as well. And you can see they have one of their homemade puppets. I think that's a rooster that they're holding. We were successful with our child health program, but in the process we stumbled into a lot of community development issues. And this is one of our training programs on the action scales of development. Many of the groups wanted to form income-generating activities because, of course, as volunteers, they weren't getting paid. Our courses became quite popular, and the university asked us to put together continuing education programs for graduates and also for others outside of our own community. So those courses were done in English, and this is the use of a problem tree to discuss and analyze domestic violence. This is another tool in direct matrix ranking, and we used locally made rice bags for our posters because they could be rolled up and stored and transported easily. There was initial reluctance to use our trainers from the community, but gradually the university started to accept them because they were so good. We used a number of different card sort games in order for them to look at pictures. This one is for weaning, the practices that are good, bad, and neutral practices, and they discuss them among themselves and come to some agreement and teach each other what are the good practices in the community. The second big dream of the dean was to have a vibrant community program for training in rural placements for the medical students. We started with 3 placements and ended up with 30. Almost all of them now have beds and things like bed nets, and sometimes they're joined by international students. These are 3 Belgian students with that group. Because we want them to interact with the communities, we teach them some skills and tools to use with the communities, and this is the set of rural modules that we've developed. This is one on teaching hygiene in the communities. The students are medical, nursing, pharmacy, and lab now. They're multidisciplinary. And as a result, their projects at the end of their 8-week placement are much improved. They're using a challenge model, and their preceptors are now getting trained as well. An unexpected outcome of the rural placements was that some of my former students decided to set up their local NGO in the community, and this is their first project that was funded. They had peer groups in 6 of the secondary schools in Imbarara. This is one of their drama competitions again, to talk about the difficulties of being a teenager in Uganda. These are the audience. The peer groups were so successful in the senior secondary schools that the teachers decided to carry on at the end of the year. They said they were finding out things that they wouldn't otherwise find out in class during the peer groups. The peer groups also alerted us to the fact that the girls lacked confidence and also positive role models. So we arranged for young professionals to come and talk to them about possible careers that could be developed. Things they might be interested in and things they could do. Their second project of this local NGO is in primary schools, also with peer groups, this time to tackle malnutrition through the children in primary schools. They have school gardens as a part of it, and also are including the vitamin A enriched orange sweet potato project. This is the facilitators developing the training materials and snakes and ladders game using nutrition questions, and behind them on the wall the food wheel. We abandoned the food pyramid and we use the food wheel with just the glow, grow, and go food groups to introduce balanced mixed diet into the area. And they're working together with the community-based health workers in this region who are the orange sweet potato growers as part of their income generating project. The mothers are hoeing the field, and as you can see, they bring their children with them and work cooperatively together to do this heavy work.